TMD, if it's very advanced and it has caused joint hard structures
Okay.
to be affected,
ठीक है.
only then these advanced radiological diagnostics gonna help.
Right. So if like conservative management is not working, and if the patient continues to complain about pain, etc., perhaps then we should move towards these imaging.
When I was in undergraduate in Abbasi Shaheed Hospital, our teacher once said, if somebody write some diagnostic test, that diagnostic test reflects what is in his mind as a differential diagnosis.
True.
It should not be very
Vague.
vague. It has to be very specific that reflects what is the differential diagnosis.
Bilkul. That
So,
makes sense.
when I would be needing MRI or CT scan, okay, when I would be needing to refer to oral surgeon, and I would advise कि जी ये oral surgeon ही advise कर ले अगर उनको लगता है कि ज़रूरत है.
Right. So, as a prosthodontist, how many times have you encountered a patient that was initially complaining of toothache, but it ended up being TMD?
Number of times. Number of times.
Can you share an example with us?
I cannot give you number of times that I have seen patient who had was treated with odontogenic cause,
Okay.
have multiple teeth extracted, multiple root canal treatment done, and pain is not settled.
Yes, that is exactly what I'm trying to understand. कि what are the cues that we miss as a doctor?
So sometimes we are very emotional and we end up in a treatment and we are very much focused in giving crown bridge work, and if there's a sensitivity, do filling, and if there's no carious lesion, the tooth must have a crack which we are not being able to diagnose, so let's do a root canal. And when the one tooth is being root canal treated and sensitivity is not solved, maybe it is not the other tooth, or maybe there were two teeth, and after 2 or 3 root canal which may not be required, end up in losing the patient. So muscles examination, joint examination, discrepancy between centric relation and central occlusion is very important.
Absolutely. Sir, how would you pharmacologically treat this pain once you have conservatively managed it with splints, etc. to considering that
Usually, I give pharmacological before going for a splint therapy, and after a splint therapy, I hardly prescribe any painkiller or muscle relaxant.
Okay.
And for the time when either patient is not opt for a splint therapy, or we have made the impression and there's a time that we will deliver the splint. At that time, we sometimes give painkiller and muscle relaxant, and more than that, we need to advise them to have soft diet, personal regulation,
Absolutely.
watch for them if they are clinching, and very much on their habits, their postures. Many a times the people were not having a right posture that contributes too much towards TMD.
Sir, how well do you see patients responding to pharmacological treatment?
Can you elaborate it?
I mean, I'm trying to understand what kind of treatment is it that patients respond most well to? Is it being prescribed medicines? Like, do analgesics usually give better result with respect to TMD, or is it more conservative management, or is it more lifestyle changes, etc.?
So I have seen patients who have been prescribed antibiotic for TMD. I have for muscles pain, myalgia, antibiotic. Yes. I had patient visited yesterday who was being prescribed antibiotic for muscles pain.
Oh God.
उससे तो सही हो गया था.
अच्छा.
हाँ, उससे तो सही हो गया था.
That must have been an infection, something.
No.
Placebo effect then?
Placebo effect.
Oh, but which analgesics are your go-to usually?
Usually, Piroxicam and Panadol.
Okay. And if the patient does not respond to the first line of treatment, then what?
Splint therapy.
Sahi. So you don't like advance on the pharmacology. You don't advance on the drugs. You go towards something different.
I more focus on splint therapy. I get very good result with the splint. So I cannot give you exact number of the splint I have delivered.
Hmm.
But it is like, if I say it, like more than 95% success rate, I
ठीक है.
won't be wrong.